This how to use video is for the Chlamydia and Gonorrhoea rapid tests with a genital swab specimen. These tests are to only be performed by medical professionals. The components of your test kit are in a resealable bag contained within an unmarked envelope. Remove the bag from the envelope. Unpack the components from the bag. It contains the following items: 2 test cartridges, pipettes with buffer solution A and B, a clear plastic test tube, specimen swabs, and an instruction manual. 2 test cartridges. The smaller round window is where the sample buffer mixture will be placed. The larger oval window is where you will read the test result. Sealed pipettes containing the buffer solution. The pipettes with the black label contain buffer B. The clear unmarked ones contain buffer A. Make sure that the pipettes are intact and no buffer has leaked out. A clear plastic test tube with a lid. Specimen swabs in sealed wrappers. You will need to use your own timer and a pair of scissors. The first step is to collect the appropriate sample. This is the most important step in the testing process. Adequate sample collection ensures that the test can detect the infection. Open the swab packet and keep the swab ready. In men, insert the swab gently into the opening of the penis. If it does not pass, do not apply force as it may cause injury. Insert the swab about 2 cm. At least the entire tip must be inserted. Gently rotate the swab for 5 seconds and then leave it inside for 2 seconds. Remove the swab carefully, taking care to prevent contact with any other surfaces as this may contaminate the specimen. In women, clean the genital area with water to remove any discharge from the vaginal opening. Take the swab and insert it into the vagina. The swab needs to be inserted high up into the vagina so that it contacts the cervix. Be careful not to apply excessive force and cause injury. Rotate the swab against the cervix for 30 seconds. Remove the swab carefully. Take care to prevent contact with any other surfaces as this may contaminate the specimen. For the next step, take the clear unmarked pipettes containing buffer A. Before cutting off the tips, ensure that all the buffer is away from the end. Cut off the tips of the pipettes and squeeze the entire contents of the pipettes into the test tube. Next, take the swab and insert it into the buffer solution right to the bottom of the test tube. Compress the swab in the bottom of the test tube and rotate it 15 times. Let the test tube and swab stand for 2 minutes. For the next step, take the pipettes with the black marking. These contain buffer B. Once again, before cutting off the tips, ensure that all the buffer is away from the end. Cut off the tips of the pipettes and squeeze the entire contents of the pipettes into the test tube. Compress the swab into the bottom of the tube and rotate it 15 times. Now remove the swab and compress it using the top of the test tube to push out as much liquid as possible. You may now cap the test tube firmly. Shake the test tube gently for 5 seconds to ensure that the contents are mixed well, then leave it to stand for 1 minute. After 1 minute has passed, add 2 drops of the mixture to each of the test cartridges at the small round window for the specimen. Avoid transferring any air bubbles. Then wait 15 minutes before reading the result. Do not interpret your results before 15 minutes or after 20 minutes, as this may give false results. After at least 15 minutes has passed, proceed to read the result. First, make sure that there is a C line. This line confirms that the test worked. If there is no C line, do not proceed any further. The test was invalid. If there is a C line but there is no T line, this indicates a negative test result. If there is a C line and a T line, this indicates a positive test result. You need to look very carefully because even a faint T line indicates a positive test result. Please remember that these rapid tests are purely for screening purposes only. Any positive results need to be confirmed by further testing. Always seek further help at your nearest clinic or general practitioner. Any negative test should be repeated in 6 weeks. Once you have completed the test and read your results, place all the test component items in the plastic bag and dispose of it safely in a bin.